and you can find all that information. So Pam, people come to these sessions, and quite remarkable, because people come that maybe they're coming for a loved one, or they may be coming for themselves, because mental health issues are not things that people go, hey.
No, they don't want to talk about it. But
No.
I had people at my last seminar with bipolar disorder. There was a woman in there who had early stages of dementia. You know, I have a full gamut of different people looking for answers for different conditions. And I had nurses, psychiatric nurses at the session as well. I've invited medical doctors from the local university. I've invited psychologists, medical doctors themselves that I know. So, you know, I want the full array of people to come to my class, because I think that for us to make this healthcare system sustainable, the only way it's going to change is from a grassroots level up. It certainly isn't going to change top down, because medicine fundamentally is a business. You know, anybody involved in medicine today is basically at a business level trying to make money. So really there's no incentive in place right now for us to be well. It's a system that's really only sustainable as long as we're sick, which is really too bad, because, you know, fundamentally, theoretically, doctors should only be paid if we're healthy, and that's just not happening right now.
So let me step on this one right now, if I can, because when we first met a number of years ago, and you know, you were out there talking and traveling the countryside and not charging anything. You were just out there standing on every soapbox you could to get people to listen to you. Someone would look at here and see that your event here that you're charging $40 or $50 to come to, and that they'd say, well, then it's turned into a business for you. The fact of the matter is that you are releasing a book, and I can only say this because, you know, I've had people come on that have an agenda. You have to eat too. You have a mortgage to pay. You have different things. You've been doing all this research. This is one way that you get paid back for doing it, because ultimately, once you give people this knowledge, unlike in the drug companies, they don't have to keep coming back to you over and over again.
They shouldn't have to. They should just have the tools and walk away and get themselves well and be independent in terms of their health. So, you know, I don't sell products. I just basically provide information and empowerment for people to go home and get well on their own, especially where they're stagnant and they're not making any progress with regards to their health. You
were saying you kind of likened some people's mental health journey to an experience at a mechanic's.
Well, here's the thing: is 85% of the people today, 85% of North Americans in general, are going to die from chronic disease. And less than 7% of us are going to die from infectious disease. We've been able to conquer infectious disease essentially over the last 100 years through various efforts, whether it's through the invention of the toilet, hand washing, you know, getting rid of horses and horse manure off the street and replacing that with cars, you know, filtering and chlorinating our water supply. We've been able to reduce infectious disease dramatically in North America. So the infectious disease really is a very small problem, which is why the H1N1 scare is really, you know, blown out of proportion. Okay, so when we go back from break, you're going to tell us what really is the issue, because you said this has kind of been blown out of proportion. So we're going to go off to break to pay some bills, and then you're going to give us the answer. We come back with more First Take Live. Stay with us. We now know how immense the problem is, but now what? Well, you know, I think that people really need to know that there's hope. Without hope, really, there's nothing. So we have to understand that there, you know, where there are clinicians, where there are psychiatrists, medical doctors, psychologists actually properly, effectively dealing with mental health issues and substance abuse, that we have models that we can mimic and basically make universal in North America or around the world. And so that's essentially the goal of my book, which is called Addiction, the Hidden Epidemic, by the way. That's what people are going to find in my book, is the solutions are there. I talk about the problem indeed, but I also point out what the solutions are. And there's no sense talking about the problem unless we have effective solutions. And right now, where we look at, in particular, addiction or addiction recovery, there's about an 80% failure rate in conventional recovery centers, which is unacceptable. It's the same thing with chronic disease. 85% of us are going to die from chronic disease. So in the conventional model, really, the model is totally ineffective. If you have a car and you take your car, if your car's not working, you take it into a mechanic 10 times, 8 times out of 10, the mechanic doesn't fix your car. Why would you keep going back to that mechanic? And essentially, that's what we're settling for with conventional approaches today. The stats you give in the seminar you're going to be running, which is going to be happening coming up in London, Ontario on Saturday, September 26th. Interesting. 70% of the people struggling with depression and over 90% of people struggling with addiction fail to seek treatment. As many as 20%
You're going to talk about at this seminar, 20% or one child in or adolescent in 5 may have a mental health disorder. Sleep disorders such as chronic insomnia affect about 10% of the population. And all of this you're going to talk about and help people figure a way through from your perspective.
Right.
And not just your perspective, but it's not just your perspective. You have gathered...
I'm just reporting on this.
You're just a researcher.
I had psychological problems myself. I had chronic fatigue and fibromyalgia for 12 years. I was disabled and I had to learn myself back to wellness. I couldn't find help in the medical establishment anywhere. So for me to get myself well gives me a lot of empathy for anybody struggling with a psychological disorder, whether it's a sleep disorder, whether it's addiction, whether it's depression, anxiety, whatever the case may be. Autism, for instance. That's why I have so much empathy for children with autism, because chronic fatigue, the nickname for chronic fatigue is adult autism. Is very, very similar in terms of what you're going through biochemically. And so essentially when you're looking at these disorders, you have to consider, you know, where the nutrient deficiencies occur, where the thyroid, where the adrenal, where copper toxicity or other metal toxicity may be occurring. And you have to look at all of these things, and where the clinicians are concerned in my book, they see a pattern with all of these conditions and where all the toxicities and deficiencies are very, very similar.
If you couldn't get anybody in the allopathic world to follow along with you, meaning the doctor's world, with the knowledge you're giving people, can people help themselves?
Well, it depends, again, on how serious their situation is. What I really want to do is smoke out the doctors who do know that the answers are, you know, naturally oriented. And unfortunately, the doctors are very stuck right now. I wouldn't be sitting here, Garth, if I didn't know multitudes of medical doctors who are frustrated with this system that we have right now, this extremely unsustainable system. It's the medical doctors who gave me the confidence to do this work today, because they don't want to write prescription drugs. They want people to get well naturally, because they know the side effects of these drugs. They see it in their offices day in and day out. But because they get paid based on this revolving door, the number of patients, the more patients they can see in a day, the more they get paid. So the faster they're in and out of that office, the better. So that's basically what facilitates their income, is writing prescriptions.
So to wrap this up, people really need to get a hold of you. They got to get to your website. So we're going to thank you for being a part of the show. Thanks for making the trip.
Thanks, Garth.
You can get to Pam Killeen, www.pamkilleen.com. Thanks to Paula, thanks to Mike, thanks to Donnie, and thanks to you for watching tonight's show. Until we meet again, take good care of yourself.